Good morning. I'm Celine Fortin, Associate Executive Director of the ARC of New Jersey. We are New Jersey's oldest and largest advocacy organization for children and adults with intellectual and developmental disabilities and their families. I want to thank Chairman Pallone and the distinguished members of the subcommittee for recognizing the concerns of this most vulnerable population. You've received my written statement, so I'm only going to highlight two issues now. Recent rule proposals made by the Centers for Medicare and Medicaid Services, CMS, that will have a potentially catastrophic impact on individuals with intellectual and developmental disabilities, and pending federal legislation that will positively impact this population. At the outset, it is important to underscore that despite improvements that can be made, Medicaid works, and it is a critical lifeline for our country's most vulnerable populations. For many people with disabilities, Medicaid is the only source of funding that helps ensure that they can live and work in their own communities and avoid costly and segregated alternatives. With that said, we have serious concerns with CMS's recent proposed rule changes. First, CMS's interim final rule on case management goes well beyond the policies established by Congress in the Deficit Reduction Act of 2005. The ARC of New Jersey has many concerns with regard to this rule, which are included in my written testimony. For example, current Medicaid policy provides federal reimbursement for states for transitional case management services for the last 180 days of an individual's stay in an institution. This funding is critical to ensure that people move from institutions into community settings successfully. The interim final rule reduces reimbursement from 180 to 60 days, which is not even close to sufficient for these difficult transitions. Second, CMS's proposed rule on rehabilitative services is also of great concern, as it creates new obstacles for Medicaid beneficiaries to receive medically necessary rehabilitative services. The proposed rule would severely harm people with intellectual and other developmental disabilities by eliminating long-standing day rehabilitation programs for many people with disabilities. It also imposes a discriminatory and arbitrary exclusion from receiving many rehabilitative services for many people with intellectual disabilities and related conditions. These services enhance the independence of people with disabilities, and removing them is extremely problematic. Third, CMS published a final rule to address school-based services and transportation. While the final rule is attempting to address legitimate policy issues, we believe that it constitutes bad fiscal and social policy. The savings to the federal coffers will be minuscule compared to the enormous impact on school systems, which rely on appropriate Medicaid reimbursement to serve children with disabilities. This rule will likely result in greater need for Medicaid services and expense in the future, since services not delivered to children can exacerbate their disability and result in more costly treatment in adulthood. It is important to note, however, that the Protecting Children's Health in Schools Act of 2007 would provide a common-sense solution to this dilemma without unduly harming school systems and students with disabilities. In addition, we would like to thank you, Chairman Pallone, for your leadership in securing a 6-month moratorium on rehabilitative services and school-based services transportation regulations. We strongly urge Congress to either extend this moratorium and include the case management regulation for at least 12 months, or pass legislation to fix the policy changes embodied in these Medicaid regulations. I would now like to briefly address pending legislation that will positively impact people with disabilities. In particular, thank you to Chairman Pallone for sponsoring the Community Living Assistance Services and Supports Act. The CLASS Act creates a national insurance program to help adults who have or develop functional impairments so that they may remain independent, employed, and a part of their community. Funded through a modest voluntary payroll deduction, the CLASS Act would allow individuals to access supports and services without requiring them to spend down their assets and become impoverished to qualify for Medicaid. A second piece of important legislation which we strongly support is the Community Choice Act, which emphasizes person-centered planning and self-directed services. As you have heard, the Community Choice Act is a step in the right direction for both the Medicaid program and individuals requiring long-term supports. The ARC of New Jersey urges Congress to swiftly pass these two critical pieces of legislation, as well as other legislation which I mentioned in my written statement. We look forward to working with you, Chairman Pallone, and other members of the subcommittee on these and other issues affecting individuals with intellectual and other developmental disabilities and their families.
Thank you. Exactly 5 minutes. Ms. McCormick.